For our first presenter, we have Danielle Baird. Now, Danielle is a research dietitian with the CSIRO and is particularly focused on food intake behaviour, dietary patterns, better understand Australian food choices and dietary behaviours. Danielle, you have 15 minutes, including questions, and I'll let you know at the 30-minute mark.
Let this time begin.
It begins. Over to you, Danielle. Thank you.
Good afternoon, everyone, and thank you for the introductions. My name is Danielle, and as you've been told, I work for the CSIRO, specifically in the public health and wellbeing team there. Today I'll be sharing some insights from our recent research exploring public perceptions of citizen science in health and wellbeing across Australia and what these findings mean for shaping future projects in this space. This work is part of a broader effort to make research more participatory, transparent and impactful by engaging Australians in health and wellbeing science. Citizen science has been growing rapidly in the environmental and ecological research, where community participation has been a key driver of large-scale data collection and real-world impact. This conference is testament to that. A lot of it is about the ecological space. But in contrast, its application in health and wellbeing is still relatively new, but we are now starting to see a steady increase in the interest and activity. A 2022 scoping review by Marks and colleagues examined over 80 citizen science projects in chronic disease prevention. This review found that while citizen science is gaining traction in public health, most projects remain relatively small in scale, locally focused, and lack that rigorous evaluation. This sets the stage for our own research, exploring how the Australian public perceives citizen science and what would it take, what do they want, to get involved in health and wellbeing projects and to what capacity. So our main aim with this work was to explore how Australians think and feel about citizen science in the context of health and wellbeing research. We wanted to understand what people already know about citizen science, what they see as the benefits or barriers for getting involved, and how interested they might be in participating themselves. We also wanted to find out which health and wellbeing topics people are most curious about or that they feel most important that we need to focus on. So altogether, these insights are helping us to build a clearer picture of how to design inclusive and appealing citizen science projects, ones that people really want to connect with and make participation feel meaningful and accessible, and I guess most importantly relevant to them. So how did we do this? To get a well-rounded understanding, we used a multi-method approach combining both qualitative and quantitative insights. Firstly, we partnered with AREMA Research, one of Australia's leading providers of government and social research, consulting and advisory services. So AREMA collected the qualitative data, they did the market research for us. They ran 4 focus groups and 2 online discussion boards across Australia. These sessions explored awareness and understanding of citizen science, their motivations and barriers, the types of projects that they feel comfortable contributing to, and what can be done to better support engagement. In parallel, we ran a short online survey. This was between March and December last year. This was a quick 15-minute survey to get we wanted to capture a broader audience, but it allowed us to quantify some of these perceptions, things like topic preferences, terminology, prior experience, and reasons for or against participation. And finally, we had an open submissions form on our Citizen Science in Health and Wellbeing website. If you haven't seen it, jump online and take a look. It's sort of relatively new. But anyone could jump on and suggest any new project ideas or research areas of interest. So together, these 3 components were designed to give us both depth and breadth, helping us to understand not only what people are thinking, but why. So who took part? Here's a quick overview of the 3 different methods. The qualitative research run by AREMA, this included 63 participants across 4 focus groups and the 2 online discussion boards. This sample was deliberately collected to be more demographically balanced, so there was a fairly even split by gender and the age groups, and with a broad representation from different education levels, which was really important. In contrast, our online survey, it's not uncommon. It attracted a larger sample, so we had over 1,100 Australians, but it was skewed towards that older, higher educated female demographic. And that's not unusual for us, unfortunately, that health-related online surveys, that's the common demographic we get involved. But it does help with the context of interpreting some of the results, especially topics of interest. The website submission form was open and anonymous, so we didn't collect any demographic data there. But together, these samples gave us both representativeness from the qualitative research and the breadth from the larger online survey. So it helps to ensure our findings reflect both the general population, but also those that are more inclined to participate as well. Awareness and understanding were mixed, and I think we'll find this across the board. In the qualitative research, many people were unsure of what citizen science, what it was or what it meant. Some thought it might relate to citizenship or that they might need some formal qualifications to be involved. So they didn't quite understand it was about that public participation. From the survey, however, and you can see the bias in the sample, we had 70% had already heard of citizen science, over 50% had previously participated in some form of citizen science, so which is quite high, but it shows that there is a growing familiarity as well. Within the focus group conversations, we did have some concerns, I guess, that came up in this group about concerns about public rigour and about the scientific skill set that they might have, and that they questioned possibly the scientific quality, how good would that be? But at the end of the day, when they talked through it, they definitely felt that the benefits far outweighed the negatives. Terminology clearly matters. So the qualitative research found that participants preferred a term that was more accessible and relatable, so not as formal as citizen science, which they thought. They liked words more like community, public, or people's science, and that resonated with them a lot more strongly. With the online survey, however, preferences varied by familiarity. So those that had heard of citizen science or engaged preferred that term, but those that didn't know that term or hadn't participated preferred the more collaborative tones and wordings. So I guess this highlighted to us the need for contextual language. Like we, yes, use the word citizen science, but we need to overlay it with some other terminology that people can sort of grasp a better understanding of what it is. So this is about motivators and barriers. We saw some strong intrinsic motivators from both methods, and I guess what came out really strongly was topic. It needs to be something that's relatable, or that people had an interest in science itself. They had a desire to make a difference. They wanted to be engaged in something fun. They wanted to be involved with something that was community orientated, or where they could actually feel that they could make a meaningful contribution. The extrinsic motivators, they include like maybe some form of reward, or something that of personal benefit to that person, or perhaps even learning a new skill. And so the survey confirmed these findings, so the topic relevance, learning and the personal health benefits were the biggest draws. On the flip side, barriers stemmed from a disinterest in the topic, discomfort in maybe the topic itself, or a lack of confidence. So some people felt that they might be underqualified or reluctant to share personal health information, which is not surprising, I don't think, especially when you have some sensitive topics like diet or specific health information. In the survey, time constraint was another major barrier. People want participation to be flexible, low effort, but also meaningful. So when we talk to people about how they'd like to be involved in citizen science, we saw a clear pattern emerging from both the qualitative and the quantitative findings. In the focus groups at the top, participants tended to favour simpler, lower effort roles, things like collecting or providing data. And they felt less comfortable with activities that they felt was more technical or academic, such as the designing research methods or writing up findings. Many describe these higher-level tasks as needing a formal qualification, specialist expertise. So as you can see, as the perceived effort increased and skill requirement increased, their interest level started to drop off. The survey results, however, showed a slightly more confident story and probably shows the bias in that sample, that 43% of people felt that they would be open to any level of participation and involvement. 22% were keen to contribute to co-designing questions or methods or taking part in early research stages. And 17% preferred sort of those early, like just the more simple data collection methods. I will go back to that one. So while deep engagement and co-design may only attract the smaller segment, there's a large and curious audience out there. That's what we found, and they really want to get involved. But I guess particularly it needs to be accessible and personally meaningful to them. But it also helps us with planning projects and thinking about tiered participation levels. So matching people's comfort level, their time and skill, and hopefully as they get more involved, they get more confident over time. Topics of interest. So we asked people what they want to know about in this space. We didn't want to go out there and say what we thought is important. We asked them what they thought. So where the Venn diagram meets, so where the topics that emerged from all three were things around diet and nutrition, specific medical conditions. Cancer came up quite a lot in that one. Community and societal issues. Isolation was one of them, and connectedness with the community. Wellbeing and mental health and drivers and associations of those things. Ageing and longevity, and also specific gender health issues. And we found very strongly, specifically from the online survey, which is no surprise it was more women, but menopause and perimenopause come out really strongly in that. Some of the more niche topics, the ones that might have come out in one or two bubbles, but not all three, were like environmental impacts and hazards, exercise, sleep, brain health, preventative health. But also it just helps us give us a good, rich landscape for future projects. What's next for us? We're currently designing an animated citizen science explainer. It's going to go up on our website very soon, and a lot of the pictures that came from on the slides today were a part of that. And that, I guess, is just to help clearly communicate with people what citizen science is and how they can get involved. We're also doing a 360 feedback survey, so we want to validate those topics that are emerging and just see if we're getting it right. And then once we've done that, we want to pursue one or two of those pilot projects in those high topic interest areas. So I guess our goal really is to move from insight into action and show some real examples of citizen science in health. What more do we need to do? I guess a clear takeaway from this work was that the need for greater communication and visibility. Many people don't even know that these opportunities exist. One participant said that it's the first time I've heard about projects I can contribute to. So building awareness, using accessible language and demonstrating tangible impact will be essential for growing participation in this area. And we're very excited about citizen science and how it can help transform public health research. People are engaged, they're open, they're curious, they want to get involved, which is exciting. So we should be playing in this space. 2 minutes, I think I can manage that. And if we get it right, we can become a really powerful force in improving public health. Just want to acknowledge Arima, who did the qualitative research, the rest of the project team, which includes my colleague here, Katie, Maddie and Emily, and Monkey Stack, who has helped design our animation. Thank you.